I'll show what you actually get in this handbook and how it works in real shifts. You will find a link to purchase this and other models at a discount in the description below the video. You can place your order right now. I'd prefer to film the book in hand, but today you'll see a clean screencast tour so we can focus on the content and decide if it's worth your money. On the product page, the cover is up first, and the authors are listed along with the latest edition details and formats like paperback, spiral, and Kindle. I open the preview and scroll the table of contents.
Did you know that the best discounts on Amazon last only a few hours? That's why I launched 2 channels where I publish the highest discounts on Amazon products in real time every day. Follow the link in the description and subscribe to our Threads and Telegram channels right now to consistently save money on your everyday purchases.
The structure is simple. Tests are organized alphabetically with quick tabs, cross-references, and an index. Each entry follows a predictable pattern, so you don't waste time on the floor. There's the test name, purpose, specimen type, required tube or container, patient prep, contraindications or precautions, interfering factors like recent meds or diet, the collection steps, and what to do after the draw or procedure. Nursing implications sit near the top or bottom depending on the test, and that's what most of us need during a shift. I zoom into a typical blood test page. You get normal reference ranges with age and sometimes sex differences. Critical values are flagged in a clear way so you can spot panic thresholds fast. I check how they present interfering factors. It's practical. Things like hemolysis, prolonged tourniquet time, or certain drugs are called out. For bedside teaching, there's a patient education box that explains what to expect, fasting rules, and what symptoms to report. That saves you from ad-libbing explanations when the room is busy. Scrolling through cardiac and coag chapters, the layout stays consistent. For troponin, the book emphasizes timing and trends rather than a single number. For D-dimer, it reminds you that a negative can help rule out a clot in low-risk cases, but a positive doesn't confirm one. That nuance helps students avoid overcalling results. In chemistry panels, the handbook shows why you'd order a CMP or isolate a single electrolyte, then lists the clinical meaning of high and low values in plain language. For A1C, there's a short note on monitoring intervals and factors that can skew results. For ABGs, the interpretation section is brief, but points you toward respiratory versus metabolic patterns without turning into a full acid-based lecture. I move to microbiology and imaging. Entries explain collection technique, site labeling, and transport time so you don't lose a sample to delays. Imaging sections cover basic prep like NPO windows, contrast allergy questions, and post-procedure monitoring. Safety alerts and infection control notes are visible enough that you won't miss them. Icons cue special populations such as pediatric, geriatric, and pregnancy considerations, which is useful when you're updating care plans. I check the usability features. The index is thorough and the cross-references are good, so if you can't find ferritin, you can jump from iron studies. The typography is dense but readable. In print, the paper is decent and the binding depends on the format you pick. Spiral is easier to keep open on a desk, paperback is cheaper and lighter, and Kindle gives you search, highlights, and quick jumps between sections. If you plan to look up values on the go, Kindle search is faster. If you like writing sticky notes, Spiral wins. Now the limits. This is not a pathophysiology textbook, and it won't teach you disease mechanisms in depth. It focuses on what the test is for, how to do it correctly, and what abnormal looks like with short clinical notes. The tone is reference first, so you get speed, not long explanations. Some editions use mostly US conventional units. If your facility lists SI units, you may need a quick conversion. The font can feel small in low light. On e-ink devices, some tables look cramped and image quality is just okay because it's a reference, not an atlas. If you expect color diagrams on every page, you'll be disappointed. It also won't replace your facility's policies. Tube colors, transport media, and panic thresholds can vary, so you still follow local rules. Who should buy? Nursing students who need a dependable lab value source for clinicals, new grads who want a single book with normal ranges and implications, and ambulatory or home health nurses who need quick patient teaching scripts. It's also handy for precepting because the consistent entry format lets you teach a repeatable approach to any test. If you already carry multiple specialty references, this can still replace a couple of thinner lab guides by consolidating steps, ranges, and teaching points. I test a typical workflow. You get an order for a CBC and troponin. You open the CBC page, check the specimen and tube, confirm whether the patient needs any prep, and scan the range tables. After the draw, you skim the implications so you're ready to discuss results with the team. Then you jump to troponin. Verify timing for serial draws and read the alert notes on when to escalate. That's exactly how this handbook is meant to be used, and it holds up under time pressure. Bottom line,